headphones. Okay.
Now you look.
Oh, now I look official.
Yep.
Wait, right.
Can you hear?
No,
There's nothing. Is there
nothing
anything
going on yet.
Okay, let me check. Let me make sure that the sound.
Make sure. They see they got masks on.
Yeah. Okay, so the sound should come through the headphones.
Okay, we
Yeah.
have
Okay.
No.
everyone's here except for, okay, everyone's here except for Paul and Matt. Could I get a motion to approve the agenda?
So moved.
So move.
Okay, all in favor, say aye.
Aye.
Oh, I thought, okay,
The agenda. I'm in favor.
okay. Okay, all in favor, say aye.
Aye.
Opposed? Hearing none, agenda's approved. Approval of the minutes to the January 21st meeting. Could I have a motion for that?
So moved.
Tim made a motion. Is there a second?
I'll second.
Who? Okay. Okay, Julie, the second. All in favor, say aye.
Aye.
Opposed? Hearing none, the minutes are approved. Public comment, there is no one here from the public that needs to make anything. Okay, then we'll go right on to the program manager reports. Start with Sue.
Good morning. For our newest member, I'm Sue Norton. I manage the behavioral health department here at Kewaunee County Human Services. I oversee all our outpatient mental health, outpatient AODA, intoxicated driver program, comprehensive community services program, community support program, and our crisis program. So my update since last month, we had the Department of Quality Assurance. Our programs all have to be certified through the state and approved, and we get audited. So since our last meeting, our crisis program, our community support program, our outpatient mental health and AODA programs were all audited by the state. When you get your certification or when they come there, there's a few options they can do. They can either pull your certification, which means that's not good. You get your certification pulled, you're no longer able to continue as a certified mental health program. You can either get a provisional recertification, which means they come back and you get it for 6 months and then they come back and take a look at where things are at. You can get 1 year recertification or a 2-year recertification. And we got a 2-year recertification for all of those programs. Our CCS or Comprehensive Community Services Program, they will be coming back next month to do the audit. And I'm anticipating that we're going to get a 2-year recertification on that. I wanted to highlight a bit about our crisis placements. When I speak of a placement, I'm speaking about an inpatient psychiatric hospitalization. So on average, when someone goes in on an involuntary, meaning they're not willing to go themselves and they're at risk of harm to self or others, the average stay is between 3 and 10 days at the cost of anywhere between $1,200 and $1,800 a day. So in December, when I was looking back at the stats, we had 27 contacts, and of those 27 contacts, 4 people we had to place in a psychiatric hospital for an involuntary admission. The others were either we were able to safety plan and they didn't need that higher level of care. In January, we've had 22 contacts. We've had 4 of which were involuntary placements. Since Saturday, we have had 4 involuntary placements in the psychiatric hospital. So we're already at, just since Saturday, the same amount that we've had the last 2 months. So in addition to those 4 placements, we have 2 people who have been what I would consider a long-term placement. Long-term can be over 10 days, one of which will be several months. So when thinking about when we did our 2021 budget, we haven't had anyone in a long-term, like institutional placement since 2018. So in 2021, when we were working on the budget, we did not anticipate a long-term placement. And this one will be several months, a placement there. So it's going to probably we will likely exceed our crisis budget just from that placement alone because it wasn't anticipated. So I think COVID is the effects of COVID is having some play into this because our numbers are just continue to rise. Crisis staff continue to do their best to safety plan. That's the least restrictive means, and statutorily, that's what we're required to do. However, there are times when your hands just get tied and you have to do what you have to do. And so depending on what placement or where they go, kind of the cost of it fluctuates a bit. So we have 2 people in longer placements right now. Hopefully one will be out, I would hope, in the next month. And the other one will continue probably for several months, even up to a year is a potential option. Any questions? Yes.
How many people does it take to get someone placed? Do you have to have so many people sign, like a sheriff or
Yes.
parent, or what does that mean?
Yes. So years ago, law enforcement used to be able to just authorize a placement on their own. That changed probably like 3 or 4 years ago. Now it's a certified crisis worker. In addition to the law enforcement agent has to work together and make that determination. So law enforcement actually will detain them, kind of like arrest, but it's really not an arrest. They take them into their custody. And then based on our decision, and we work well together. And in our agency, we make it a standard that you're not typically, unless it's super cut and dry, that you're not making that decision alone, that there's usually some other staff person involved in it or myself involved with it as the manager to make that determination. Because you're taking away all their rights, that you're taking them into custody, they may have jobs, it's a big decision, and ultimately we're looking at their safety. So we make it a standard of practice to run it by at least one other person to get feedback to make sure we're doing what we need to do. Yes, you're welcome.
Sue, I got a question for you, and maybe I missed it. I was shutting the phone off for Linda.
Yeah.
When people go in, clients go in, does their health insurance or something kick in after a certain time that the county's not responsible for constantly paying this $1,200 to $1,800 a day? Is there something out there?
Good question. Medicaid will pay for anyone under the age of 21. When you hit the magical age of 21, they no longer cover any of the cost of it. Medicare will cover some of it up to a certain number of days. And depending on the commercial health insurance and the benefit, sometimes they get coverage that way.
And so typically these clients, do they have private health insurance or do they not?
They typically do not have. So oftentimes we get those who are on Medicaid or they're uninsured. So then usually what we do then is we will pay for the cost and then bill the client for the cost of it. Whether you get much back is left to be seen. Yeah, unfortunately, Medicaid, for whatever reason, they don't cover over the age of 21.
Any other questions for Sue? Okay, then
Thank
we're moving on to Melissa.
Good morning, everybody. So just as a reminder, so I oversee birth to 3, children's waiver, CST, which is our wraparound approach, adult protection, and the transportation program. You have the stats that we provide each month, so certainly take a look at those. And if you have any questions, you can let me know. Just a few updates from those programs that I oversee. It was asked that we kind of shift the focus of our discussion to these placements that oftentimes are expensive and very traumatic to the consumers that are impacted. From the perspective of my unit, there's less focus on placement and more focus on preventing the placements. So the placements that Sue and Corinne may speak of, I guess you can think of our unit as being there to support those consumers who are impacted and attempting to provide services to reduce the cost of some of those placements. So for example, for the kids that are impacted, if some of them need to go into a foster home, we may seek to find out if they might be eligible for children's waiver, and which waiver then can cover the cost of some of those placements. We currently have 2 waiver consumers that we're concerned are going the way of potentially needing placement. So we are doing what we can on our end to prevent that. We're using that wraparound approach, finding informal and formal supports to better serve those consumers in an attempt to avoid those placements. From the adult protective standpoint, in January, there were 9 referrals. So that was a pretty high month for us. Unique referrals, several were able to remain in their home with additional supports, and several were removed from their home. Jody, our APS staff, did a great job avoiding emergency protective placements for those folks. She was able to identify informal resources or placements that were covered by insurance. So that's the unique thing about needs for the elderly, is oftentimes we're finding those placements, usually at the hospital or nursing home, will be covered by Medicare or their supplemental insurance. Usually with APS, we're looking at financial exploitation cases. The last several months have been good for us here in Kewaunee County. Just to summarize 2020, so in Kewaunee County, we had nearly $155,000 of funding connected to that financial exploitation. It's too high. It's too high across the state, nationwide as well. So it's certainly going to be a continued focus. We, from the APS standpoint, each county is now required to fill out a financial exploitation spreadsheet to track that funding. We submitted those at the end of 2020. And so far, it sounds like about 20 counties have reported what they found in 2020. So 20 counties reported their 2020 funding. And of those 20 counties, there's already identified $15 million connected to financial exploitation in Wisconsin. Switching to CST, or the wraparound approach, our 2021 plan, CST plan and budget were submitted and approved. So we'll be focusing on supporting youth who are transitioning into adulthood. So those youth with special needs, whether it be cognitive, physical, developmental, and even mental health, we're just better providing better education to our committee and to the community about guardianship, ADRC resources, consulting with DVR for needs, and the committee is going to be focusing on what else we can use what other services are out there, and what we can do to make that process a little bit more seamless for those youth. It's a stressful time for the consumers and their families as well. The goals in our 2021 plan also include taking a look at increasing the use of family review roundtables. That's just better collaboration within our agency, better utilizing all of the knowledge that we have within our agency to come up with unique strategies to better support the consumers that we're serving. We're also going to continue to cross-train our staff. It's trauma-informed to do that, to just have 1 or 2 agency staff working with a family rather than one from each unit that they might be connected to. And then we're also going to take a look at improving staff morale within our agency. In the past, we've used the Professional Quality of Life survey. So it'll be interesting to submit that to staff again and measure how we're doing compared to where we were several years ago. We did that back when Bob Mattice was our director. So it's been several years. Birth to 3 has been fairly simple. We continue to see the benefits of having Carol, our birth to 3 coordinator, cross-trained in CLTS, benefiting the consumers. Again, it's trauma-informed to just have the one worker, and for her to be able to connect those consumers to additional waiver services is great. Questions for me? Okay, thank you.
Thank you. Then we'll move Moving on, Corinne?
Yes. Corinne Conkle, I'm the Child Protection, Youth Justice, Adoption Foster Care Manager in the Children and Families Unit. Again, you have our numbers. They're fairly similar to, where the trends that we've kind of been seeing here, just an increase in reports and services required for folks. So again, questions about that, let me know, but those are pretty standard. We have gone since December, we've gone from 2 children in out-of-home care to 10 in out-of-home care. That, as we discussed last month, is based on safety matters that require being addressed. Similar to Sue, that is an increase that was not expected or planned for budget-wise. So that's a part of the reason we are sharing that information with you all. It also impacts, obviously, case management and workload and things of that nature for our staff, which blossoms into another matter for our department, which is the resignation of one of our staff members. I believe that all of you have seen her resignation letter. If you haven't, certainly that can be provided. Again, we've talked about that on several occasions. I think in this committee meeting, it's certainly been a matter for the board. I truly believe the decision of that employee was made based on finding employment elsewhere where she could rely on some predictability and stability of benefits and pay. And I don't think I need to delve further into that. You all have some idea what we've talked about in this committee about the potential risks to our staff when certain decisions are made regarding those matters. We have initiated, we found out kind of by accident that we were approved for a change in the spending of some of our reimbursement funds that we get from the state. So we have decided to move a decent portion of that reimbursement to a parent coaching program, which is something that our unit and department desperately needs. So we have worked together, our units have worked together with Innovative Services. We're looking at another program as well that we can then cover some of the costs of starting some parent coaching services for the folks that we serve in all of our programs, human services wide. I don't know that there's any more that I have to add outside of that.
So Corinne,
Supervisor
Oh, sorry.
Lazansky, speak into the
So-
mic, please.
Corinne, last time you spoke about the family with the 7 children that you had to a place and you didn't know if that was going to be short-term or long-term.
Right.
So do you know at this point if it's short or long?
I guess I'll speak in generalities. I'm somewhat uncomfortable. I've discussed this with Scott regarding just the on the record as opposed to closed session type discussions about these matters. But what I'll speak more is the generalities of how we work in Child Protective Services. We are required by law to have what's called a concurrent plan for children. So we are required to be planning immediately from the time that we place a child to send them home safely and in a responsible way. We are also required to plan for their permanence long-term. So I would say, I will very early in cases always answer that question for you all, saying we are doing both. We are planning for it to be short-term, but we are also planning for it to be long-term because it's really hard at the beginning of a placement to determine the actions of families, and parents, and children, and what's going to be necessary for a family. So that's a roundabout way to say I'm not certain. We always hope for short-term for every placement. Certain factors that are out of our control are really what determine the length of a placement. But we do plan for both.
Any other questions for her?
If I may, Madam Chair, I just wanted to follow up and expand a little bit on what Corinne is talking about regarding parent support and parent teaching and those types of things. In my conversations with all of the unit managers, what we're seeing a lot of times is we may be providing services to a specific client, whether that's an adult or a child, but more often than not, it's not that specific client that is the only person that needs services and support. Especially when we're coming from a child standpoint, a lot of times the parents themselves, the family themselves need support as well to help support that client as well as to address some mental health needs that they may have. And so what we've been trying to do, and I completely support what Corinne and the unit managers are trying to do, is we're trying to take a little bit more of a holistic approach. And I'm just making up the example, if you have a 10-year-old boy that has behavioral problems, more often than not, the parents themselves need additional support as well.
Yeah.
Because that 10-year-old boy did not have that problem all on his own. And so what we're trying to do is take a more holistic approach that not only supports that boy, but supports that mother, that father, those siblings as well. So I'm really happy with kind of I won't say a new direction, but a better direction, trying to address some of these things. So I just wanted the committee to be aware.
Okay.
Good.
Okay, then we move on to Brian.
There we go. Good morning. I'm Brian Johnson, the
Brian,
financial.
a little closer to your mouth, please.
There we go. Must be this. I'm the financial manager for the Human Service Department, and I'll go over the financial package that was sent out for you. In the past, we've gone over it in a little more detail. I think I'm going to kind of hit a little bit overview of it. Anyway, so if we take a look at the billing report, this should be pretty much final. We've kind of wrapped up most of our billing. There might be a little bit more trickling in. So it looks like for 2020, we're going to have about $2,272,000 billed out, compared to last year, which was about $2,362,000. So we're about 90,000 lower from last year. But I do anticipate us collecting about $1,544,000 in revenue, and that will be trickling in the next couple months yet to have a final number. But compared to last year, we got $1,600,000, so we're about 56,000 lower from last year in revenues. And just to let you know, our revenues came in at about 67% of what we billed out. So we're in line with where we've been historically. On the state aid report, we have billed out about a little over $3,019,000, or claim that much. We anticipate receiving in $1,954,000, or about 64%. And now we have filed our December numbers in January, and we will be getting everything back in the next month or two for money-wise. But we will be doing the final year-end claims by the end of March, so that money doesn't come in till end of April, early May, and that's usually just little cleanup things that might be missed, or invoices or things that would trickle in through reconciliation. So that's kind of where we're at with state aids. For contract status reports, I gave you the final for 2020 and the start of January for 2021. You'll notice that in January, we pay most of our December expenses. So those are rolled over into the column called YE, year end. And the items that we paid in January for January are on the January report. Anything that needed addendum has been taken care of, even though it doesn't reflect on this report. So we should be good there. Looking at the payments, we had $230,000 worth of payments made in the month of January. The only thing really to note was we paid $64,500 to the Algoma School District, and that is part of our Youth Justice Intervention Program. And again, that program is a pass-through. What we paid out, we will receive back from the state 100%. So there's no cost to the county for that. We're just basically cut the checks and deposit their checks to offset it. There should also be the credit card statements for the managers for January attached to this. And now looking at the financials for the month of December, this is at 100% of where we are to budget. We still have some items trickling in. But from what I've been able to do, looking at all the December expenses and everything for 2002 is pretty much all in. There might be a stray invoice or something that still comes through that will be charged to 2020 if when we get it. But otherwise, the expenses are pretty much in. Revenues, like I said, will still be trickling in for the next month and a half, 2 months or more. But what I've known about, I've put in here. So I'll just kind of go over some of the areas where there's some main items to talk about. I did include the WIMCR payment that we received in December, $617,000 I put it as a line item up in the admin section so it didn't get buried in the other revenues against the tax levy. So you can see where that is. Going through on children and families, again, with that youth intervention grant, we had received $82,000 or will have received, and we will also make expenses. So $100,000 for that program will be received in and paid out for 2020. In behavioral health, we're pretty good on our revenues that we anticipated in, but as far as expenses, as Sue said, with our Winnebago on placement charges, we're about $189,000 over budget in that area for 2020. And family and communities, the only thing of note is that our CLTS third-party payments have been higher and the reimbursements have been higher in that area, mainly because of the reduction of the wait list. We have taken number of more children off the wait list and put them into the program. Looking at the bottom line for where we anticipate being at the end of the year, this is before the audit. We still have an audit coming up in May, and we'll still have a few things that will trickle through. But right now, it looks like we will have come in at about 884 over budget positive for the year. And that includes the WIMCR. So with the WIMCR, we're still going to fall somewhere between the 200 and 300,000 above for operations in the positive area. Our revenues, we are at 124% of over budget, and our expenses were at 103.4 of expenses. There should be some additional revenue coming in. We normally get some reimbursements for people in placement at Winnebago through MA that normally come in about February, maybe March. So what they recoup, and they'll send passport onto us, that will get applied. And we don't have that number yet. And there might be an additional, some GWAR money coming that we normally claim at the end of the year. That's kind of surprise money that we get in February or March. So otherwise, this is next month, we'll be moving on to January's numbers. And any questions on the financials?
I'm just going to add a couple things, Brian, if that's
Go
okay.
ahead, Scott.
So Brian talked about the bottom line, and I guess that's where I want to touch on, because that's always been a concern for me, as you're well aware. And there were some of those things that I just want to reiterate. Again, when we looked at the behavioral health and the Winnebago costs, though, that's the type of thing that, again, is things that we can't control but are expensive. And so that's why I had asked the unit managers to start to talk a little bit more about those than necessarily their caseloads, because it's those placements that are going to have the high dollars attached to them, which are going to have the budget effect. And so you saw for 2020, there was about $190,000 just for Winnebago. In 2021, we're going to have Trempolo. We're going to have a few others. So those are always going to be things that we're going to be monitoring and watching. But the bigger issue for me for 2020 is this. We had 124% in revenues. In other words, almost 24% higher than what we budgeted. And our expenses were only 3.4% higher than what was budgeted, which is why we have this surplus. Again, this is fantastic work by the staff that during COVID, they're able to meet with their clients, bill for their services and their contacts. And we've also started to do something that we should have been doing years ago, which is taking that WMCR payment and not touching it. So therefore you have, and I'm going to say it this way, and the only reason why I'm looking at you, Supervisor Baker, is because you had asked, what's the 5-year plan? Well, 5-year may only be 2, if knock on wood, God willing, that's what happens. We're going to be making a substantial dent into that human services fund deficit, of which, again, I am extremely proud and happy of our staff with what they've been able to do, because we'll go from 1.2 to maybe only $300,000 at the end of 2020. And I am confident, unless we have even more placements, which I hope doesn't happen, because that means that there's some real issues with our clients. But I think we will see the human services fund deficit being completely wiped out by the end of 2020.
Thank you.
You're very welcome, Rose. But so I just want to say, I just want to commend the staff for an excellent job. And then I'll wait until my human services director's report to touch on a couple other things. Thank you, Madam Chair.
Okay, anything else for Brian? Okay, then we go on to contract approvals.
You see there in front of you, there are 4 contracts for approval: Family Services, Fond du Lac, Phoenix House, and the Nitschke Center.
Are there any new vendors here, or these ones that you've got?
These are the same ones that we used last year, I believe. Go ahead, Sue.
One of them is new. We've used them in the past, but not last year. So the Gilman House was a new one. That was a step down placement from they call it a transitional living place, where if someone is in like a treatment facility or psychiatric hospital, we can step down them and transition them where they can get more support, but it's not like in a locked hospital setting. We attempted to do that prior to going somewhere, making a higher level of care. So we haven't had to use that in a long time. So that would be new but old. We've done it, we used them before.
They're on the list. We just did not use them last year. So if you go back to your previous list that was in your packet, Gilman is on there. But as Sue had said, we did not use them in 2020. But every single year we want to, reapprove these contracts.
Okay, any other questions? Not, could I get a motion to approve the contracts? Okay, Doak make motion,
I'll
Joanne second.
Aye.
Opposed? Hearing none, contracts are approved. Then the Human Service Director update.
Alrighty, I only have basically 2 things. One is, again, I may sound like a broken record, and I'm sorry if I've said this before, but again, we have great staff. If you remember, about 6 months ago, I had said to the committee that I was going to challenge our staff to look at what they're doing. Not that they weren't doing the work, but do a better job of recording and invoicing for the work that they do. In other words, start to increase their billable hours. In 2020, we had 13,932.6 billable hours. That's 453.7 more billable hours than what we had in 2019. And if you go to 2018, that was more than 650 hours more than what we did in 2018. Our staff works incredibly hard. They do a great deal of work for their clients. They did it all during COVID. And the greater thing is that in talking with them, they understand that if I'm taking a 5-minute phone call with a client, that's billable. And we're probably doing a better job of billing. They're not having to necessarily put in more hours. They're just, unfortunately, because of how we do it with reimbursements, they have to therefore do a better job of recording the billable hours that they do perform. And they've been doing that. And again, this shows in the number of billable hours that have been there. And it also shows in the financial reports that you've been hearing for the end of 2020. So again, I just want to wholeheartedly thank the staff for what they've been able to do. The two other things I want to touch on is I will be going in front of the executive committee at the March meeting and asking for approval to start the recruitment to replace that pitiful interim human services director that is there. So hopefully we can get that approval and we can start that process. I'll be very honest, I want to be very methodical. I am not in a rush to get myself out of a job, but I also am not but I'm also not in a rush to stay in this job. So it will hopefully happen in 2021 and that we can move forward.
And you're not pitiful.
Thank you, Rose. The last item that I want to touch base on is, as we know, the governor did provide his budget address on Tuesday. There's a number of items that are in there regarding health and human services. Some of it is increased funding. Some of it is keeping funding the same. I could spend the next 45 minutes going through all of those items, but I don't think that is actually worth your time at this present point. And there's a number of reasons why. One is, while a budget address by the governor is a statement of principles and what they'd like to do, it is also, and this is not a Republican Democrat thing, a state budget is a political document. And therefore, while the governor may want these things to happen, he has a legislature that is controlled by the opposite party.
Yeah.
And so therefore, some things that may be in that budget, while he may want those to happen, and one of the perfect examples I can give is the work requirement for food share and eliminating that. I don't see how a Republican legislature is going to repeal the work share, the work requirement for the food share program. And I'm not trying to take sides on any of these issues at all. All I'm saying is that if I start to talk right now about the budget and all the different things that are in there, it's not going to give you as accurate a picture than if we wait till next month or the month after that. So I suggest anyone to go and take a look. And over the coming months, I will then try to report on some of those items that have impacts on our department. But to do it right now, I would feel would be extremely premature just because it was just introduced 2 days ago and it has to go through the process. Are there any questions that anyone has? Then that's all I have,
Okay.
Madam Chair. Thank you.
Is there anything else to come before the committee? If not, then we'll schedule the next meeting as March 18th at 8 a.m.
I would like to, and Madam Chairman, I would like to thank the committee for making this meeting electronically available to me, to anybody. Thank you.
Okay, well then, can I get a motion to adjourn the meeting?
So moved.
Okay, Doak is the first. Is there a second?
I'll
Tim, second?
I'll second it.
Okay. All in favor, say aye.
I,
Opposed? Hearing none, we are adjourned.
All right. All right. All right. Thank you. Okay, Marg. It's over.